Hello everyone, I'm Cholu from Wuxi Children's Hospital. It's my honor to introduce our study. The title of our study was Multi-Parameter MRI for evaluating Glymphatic impairment and white matter abnormalities and discriminating refractory epilepsy in children. Epilepsy is the most common chronic brain disease in children. However, approximately one-third of patients do not achieve remission after sufficient administration of medicine, called refractory epilepsy. New medicine and ketogenic diet have been recommended. However, part of pediatric patients with RE show negative results on routine MRI, making early diagnosis difficult. Diffusion tissue imaging can measure the diffusion properties of water molecules in the brain tissue and display white matter microstructure and fiber tract connectivity. The GS is a newly discovered system for removing metabolic waste from the brain. DT analysis along the PVS reflects GS impairment by measuring water molecular diffusion along white matter fiber tracts. It has been shown to decrease in patients with epilepsy. However, no study has comprehensively identified the white matter, lymphatic, and brain network abnormalities in children with RE that appear normal on conventional MRI. So, the purpose of our study was to explore Glymphatic impairment in pediatric RE using multi-parameter MRI and assess its relationship with white matter abnormalities and clinical indicators, and preliminary evaluate the performance of multi-parameter MRI in discriminating RE from DSE. We retrospectively included pediatric patients with epilepsy. The inclusion criteria and exclusion criteria were as follows. Finally, 26 RE and 70 DSE children were concluded in this study. DTI data were extracted using DTI data, which were converted format and post-processed using FSL. DTI and 3DT1 weighted scans were imported into the Panda toolbox. The GHU Atlas was assigned to FA and MD images for anatomical localization, and the values of each region were extracted. Whole brain white matter connectivity was reconstructed by deterministic tractography using the AL19 brain atlas. The number of vascular connections were defined as the edge of brain network, and a connectivity matrix was established. The brain network attributes were calculated by Retina software. Finally, a CMC RVFL was used for classification. Here is the calculation of DTI ARPS. First, an FA template was created and registered on the GHU template, which was then converted into the space of dataset of anatomical localization. RIs were replaced on the left projection fibers and association fibers in the template of the uppermost layer of the lateral ventricle. Standard RIs were assigned to the FA images, and automated DTI ARPS were calculated. The results showed that in study patients, the DSE and RE groups showed no significant differences in birth weight, gestational age, seizure location, seizure episode time, or seizure frequency. The RE group showed significantly lower FA values in the genu body, the spleen of corpus callosum, right and left corona radiata, left posterior salamatic radiation, and left superior genital fasciculus with TFSE corrected P. Moreover, this group showed significant higher MD values in the genu body and spleen of corpus callosum, right and left corona radiata, posterior salamatic radiation, and inferior and superior longitudinal fasciculus areas, also with TFCE correlated. Nodal efficiency showed an extensive reduction in the RE group, with FDR correlated, and this reduction mainly involves the limbic system, default mode network, and occipital vessel network, especially in the left medial superior frontal gyrus, left angular gyrus, left superior occipital gyrus, left cuneus, left inferior occipital gyrus, left superior occipital gyrus, and right posterior cingulate gyrus. The DTI-LPS index was significantly lower in the RE group than in the DSE group. The DTI-LPS index was positively correlated with FA, and this correlation was significant in the genu body and spleen of corpus callosum, right and left corona radiata, left posterior salar radiation, and left superior longitudinal fasciculus regions. The DTI-ALPS index was negatively correlated with MD, as these figures shows. Additionally, DTI-ALPS index was negatively correlated with seizure frequency. The cross-validated AUCs of DTI-ALPS, FAMD, and nodal efficiency for distinguishing RE from DSE was 0.77, 0.81, 0.77, and 0.79, respectively. The cross-validated AUCs of the machine learning model combining multiple parameters was 0.83. This study showed that, in comparison with children with DSE, children with MI negative RE had a lower DTI-ALPS index FA and nodal efficiency and higher MD values, reflecting cerebral gas impairment and vital matter structure and connectivity abnormalities. Furthermore, the DTI-ALPS index was positively correlated with FA and nodal efficiency and negatively correlated with MD and seizure frequency. And machine learning models based on multi-parameter could predict RE in children. Basic studies have shown that paradoxical charges in the thalamocortical pathway are necessary to generate sharp waves, and that deep brain stimulation of the anterior thalamus can significantly reduce seizures in RE, suggesting that the thalamus is a potentially important region for the surgical treatment of RE. The corpus callosum is the most important pathway for the bilateral transmission of frequent paradoxical discharges in the brain. Frequent abnormal discharges cause damage to other brain areas through the injured corpus callosum, which may be one of the mechanisms underlying RE. Besides, the superior longitudinal boundary connects to the frontal parietal lobe, and the inferior boundary connects to the temporal occipital lobe, indicating a wider range of RE injuries in pediatric patients compared with adults. This study showed that nodal efficiency in the RE group was lower than that in the DSE group. And the reductions mainly involved the limbic system, DMN, and visual network. And one important point is that paradoxical discharges in epilepsy lead to GS damage and accumulation of abnormal metabolites such as glutamate and tau, resulting in increased neuronal excitability and axonal damage. In contrast, white matter abnormalities may further aggravate epileptic symptoms and produce more frequent paradoxical discharges, which explains the tendency of lesions in pediatric RE to progress and spread. This study had some limitations. Firstly, the detailed ALPS index measurement evaluates only a specific region near the left ventricle. Whether this region reflects the glymphatic function of the entire brain requires further confirmation. In addition, the detailed ALPS index is affected by the combination of water movement at various speeds and the anatomical structures contained in the voxels. Although we included MRI negative cases to minimize the effects of structure changes, the stubborn influences should be investigated. Second, although the AUC value of the MRI model was higher than that of single parameter MRI model, the difference was not statistically significant. We speculated that this may be because FAMD nodule efficiency and detailed ALPS were derived from the same detailed data, which may have led to information redundancy. Finally, the sample size was relatively small and external validation data was lacking. In the future, multi-center data should be included to improve the discrimination performance of the model. So, we come up with the conclusion. Pediatric patients with RE should impart glymphatic function, white matter fiber integrity, and abnormal connectivity in comparison with pediatric patients with DSE. Second, the impaired glymphatic function was correlated with white matter abnormalities and seizure frequency, and this indicated that the detailed ALPS index can be used as an imaging index. The third, the multi-parameter MRI model developed in this study may be flexible for distinguishing RE from DSE and potentially assisting neurologists in the development of diagnostic and treatment strategies. That's all. Thank you very much.